Hi there. In this video we're going to look at using the transparent consulting approach to Cauda Equina as a red flag condition. Now this is very commonly looked for in anyone who has got low back pain, and when I've watched training videos it's the one probably where I felt that using a transparent approach explaining why you're asking the condition could make a big difference. Massive number of times I've seen these questions asked in a non-specific way. The person doesn't understand why they're being asked and starts and will give information back which is not relevant for what you're looking for. So for example, you'd typically the doctor may say, have you had any changes or problems with your bowels or urine recently, and have you had any numbness around the groin or bottom area? Now the numbness symptom, I think that's pretty straightforward, but asking about bowel and urine problems is highly likely to get answers which aren't relevant for what you're looking for, can take you down a cul-de-sac. It might mean that you have to cut the patient off and explain why you've stopped them talking, or often when watching videos it leads to a minute or two of irrelevant answers. So explaining and finding your way of explaining Cauda Equina is very important. You may well have already started to explain about sciatica, possibly. So what I tend to say to patients in this situation is, if a disc bulges inwards into the spinal cord, it can press on the nerves which supply sensation and power to the bladder and the bowel. Now, if that were to happen, if the nerves to the bladder and bowel stop working, then you might lose control over your bladder and bowel. So you might start leaking poo, or you might start leaking urine without realising. Has anything like that happened to you in the last couple of days, or since this started, whatever's relevant to the case? And that way it's specific. The person knows why you're asking the question, and you're not going to get any symptoms related to irritable bowel or long-term urinary tract symptoms. Then when you come to the safety net, you can obviously say, remember about those symptoms I said about the urine and bowel and the numbness down below symptoms. Now, if that's happened, although it's quite rare, it's extremely serious, because if it's not corrected in 24 hours, you may not get that function back and you'd always be incontinent. So very unlikely, but if you ever get those symptoms, then you treat it as an emergency. You don't wait till tomorrow to see if it's got better. You go straight to an A&E, or whatever you want to say in terms of your safety net. Okay, I hope that makes sense. And as I said before, say these out loud, practice them. If you practice them out loud, you're far more likely to be able to allow them to flow better when you actually use them with patients.